Hi, my name is Ronan Farrel. I'm an assistant professor of medicine at the Warren Allport School of Medicine, Brown University. Colorectal cancer is cancer of the digestive tract, specifically in the colon and the rectum. There are many risk factors associated with colon cancer. Risk factors we cannot affect are hereditary diseases. Race, African Americans have a higher incidence. Age, as we get older, factors that influence our rates of colon cancer that we can affect. Obesity, huge. Our diet, smoking, activity level, all have been associated with increased colon cancer. We see many different symptoms. We see some people who will present totally obstructed. We see some people who present with very mild symptoms. They may have some mild rectal bleeding. They can have change in bowel habits. As a cancer progresses, they may have more systemic features, such as weight loss, anemia, their blood count is low. Since the mid-90s, we have noticed, on average, we are seeing more rates of colon cancer in the age group below 50. We can't exactly pinpoint the factor that's driving this change. However, it's highly suspected to be environmental, related to increasing levels of obesity, inactivity, our diet, fatty foods, processed meats. These are all the factors that we believe are playing an important role in lowering of the age. A lot of gastroenterologists felt that we should concentrate on underserved communities and try and get people who never came for their colonoscopies to come for their colonoscopies. We modeled this data and eventually we got on board with the oncologist and we agreed that we need to drop our screening to 45. That happened over the past year or two and I think it's been very effective. Colonoscopy is by far the best for diagnosing this. We do stool testing. It may be negative or maybe positive, but if it's positive, you're going to need a colonoscopy regardless. We need to get a sample of that tissue. A colonoscopy does it all in one. Diagnosis, if the polyp has progressed to a cancer, if it's not so large and it can be removed endoscopically, very often we can take these cancers out without making an incision in the abdomen. I think you should always keep a very tight relationship with your primary care doctor. These things can be brought up at any annual physical. Colon cancer is one thing that we do not want to miss. We've been so successful with screening above 50 years of age. We've really dropped the rate of colon cancer and we really encourage people to come in and get their colonoscopies, and they've done really well at it. They've heeded the call, they've come in, they've gotten their colonoscopies, and young people are not invincible. Unfortunately, this is something that's affecting them more and more, and they need to be as vigilant and come in and see us also when needed.